I don't want to exercise because I might trigger a migraine. Is this you? Does this sound familiar? Is this something that you're worried about and it actually stops you from exercising? And is this something that is a valid argument and a valid fear? Now, it's understandable that you'd want to avoid getting a migraine because for a lot of people who suffer with migraines, they have high frequency migraines, real severe, last a long time, really debilitating, struggle to work, off work, can't do what they want to do, and it's not a great thing. So of course, you wouldn't want to put yourself at unnecessary risk of causing a migraine. So it's good to know what your triggers of a migraine are, but even more importantly, what will minimize the risk of getting a migraine. So today we're going to look at some research that's looking at whether or not exercise actually reduces the amount of migraines people get and the severity of migraines people have. We're also going to find out what type of exercise, if any, is better for reducing migraine. So the research we're looking at is a systematic review and a network meta-analysis. They're basically looking at the difference of aerobic exercise versus strength training on reducing the frequency of monthly migraines. So they had 3 exercise protocols. They had moderate intensity aerobic exercise, they had high intensity aerobic exercise, and they had strength training based exercise. Interesting in this study, they also looked at the effect in comparison to medications for migraines, such as amitriptyline and other ones, and to see if actually medication is superior or inferior to exercise too. So they looked at 21 published trials. There was 1,195 migraine sufferers with a mean average of 35 years of age. So what was the strength training protocol that they applied in the strength training group? So they started with 2 to 3 sets of 12 to 15 repetitions at between 45 and 60% of a 1 repetition maximum lift. And they performed this 3 times a week. The progressions that they added were 5% of their 1 rep max each week, with a target of getting to 75 to 80% of a 1 repetition max. Again, they did 3 sets and did 8 to 10 repetitions. So what area of the body did they actually train? Well, they were training the deep flexor neck muscles, the superficial neck muscles, and also the shoulder girdle muscles. So for example, internal and external rotation of the shoulder, seated rows, presses and curls, flies and reverse flies, leg extensions, and lat pull downs. So what was the moderate intensity aerobic exercise group's protocol? So they started with a 45 to 70% of a VO2 max and a 60 to 80% of a heart rate max, and they performed their exercise 3 times a week. They had progressive increments per week, and the type of cardio they actually did was outdoor running, treadmill running, jump rope, stationary bike, and other home-based exercises. So what was the high intensity group? So these started with 55 to 60% of a VO2 max, performed 2 to 3 times per week, and an increase of 5 to 10% of their VO2 max each week, trying to hit a target of 80 to 90% of a VO2 max, as well as 90 to 95% of a heart rate max. The exercise that they did in this group was the same as the moderate group, just at higher intensity. So what did they find overall? So basically they found strength training was the best at reducing the migraine frequency per month, followed by high intensity aerobic exercise. And also, exercise was better than medication. So why is this? Well, no one knows for certain, but if we think about the strength training group, predominantly the areas trained were neck and shoulder areas. So we know there's a massive relationship between neck issues, stress, all these things around this area, and obviously headaches and migraines. So strengthening of this area, building tolerance in this area certainly makes sense, the selection of exercises. So this can't tell us if it was strength training in general. If you were to just strengthen somewhere else in your body and not target this area, there was a leg extension in there, but most of the stuff that was done was upper body and certainly neck and shoulder area. So there's the high comorbidity factor with neck pain, neck issues, and migraine. We know there's the trigeminal nerve relationship. There are local metabolic and neuromuscular adaptations around that area as well. Also, an increased amount of lean muscle mass has been shown to be associated with less migraine. And it's also known to be good for chronic sensitization. So obviously any chronic pain syndromes which migraine would be classified as. So why does the aerobic exercise work? Well, we know that exercise has an effect directly on pain itself. So it is basically pain relieving. We've seen studies previously showing this. They do directly affect this. Neurologically, and as well as biochemically. So you've got opioid and endocannabinoid, which is affected with aerobic exercise, and these are known mechanisms for migraine. So overall, as we can see, if you've got migraines, you should certainly incorporate strength training, particularly neck and shoulder area. You should do high intensity aerobic exercise versus moderate intensity. And based on this systematic review and meta-analysis, you should see a reduction in your migraine frequencies, severities. Obviously, the migraine medications obviously still can be effective, but they're not as effective as exercise. So bear in mind, this doesn't mean when you've got a migraine, you go out and hammer your exercise. You probably can't. This is more about prevention. So obviously there are lots of mechanisms as to why this is good, and certainly something worth trying according to the evidence. So anyway, that's it for this video, and I'll see you next time.